Hello friends, welcome to DLive.in podcast. I'm Dr. Gaur, low-carb consultant from DLive and the host for today's live discussion. DLive.in is a community by the Indians and for the Indians where we focus on the Indian version of low-carb nutrition to help people either manage or reverse their metabolic disorders like diabetes, hypertension, PCOS, and obesity. In general, I can say that we help people improve their overall health because while focusing on food through low carb nutrition, we also take into consideration the other factors which are equally important for the health, like physical activity, stress management, and the quality of sleep. So when we combine all of these factors together, one can definitely improve their overall health. And due to this, we have already, DLife has already reported more than 250 success stories of people who are now well managing their metabolic disorders through LCHF way of eating. And today I have with me one of the senior member from DLife who himself is an expert of low carb nutrition. He is not only managing his own diabetes through LCHF, but continuously he is raising awareness about LCHF around him and also through the DLife.in platform. So welcome Arun Kumar to the show today.
Thank you.
It's really a pleasure today to interact with you.
Thank you. Thank you.
So Arun Kumar, he is a multi-talented person because he has 33 plus years of experience in pharmaceuticals as well. So even being in pharmaceuticals, he choose the lifestyle change over the medications to beat diabetes. So well done, Arun Kumar.
Thank
You are really an inspiration for many people. And I think in future also you are going to inspire people around you.
Sure.
So Arun Kumar, could you please introduce yourself first to our viewers?
Thank you, Jasmeet. As you know, I'm Arun Kumar and I'm a senior member of DLife, as Jasmeet mentioned. In fact, I've been diagnosed as a diabetic, say 30 years back. And it was suddenly I have been diagnosed. It's some accident, you can say. Doctor told me to go for the blood test, and then this blood sugar test was also one of them. And doctor told me, now you are a diabetic, but it is an initial state. Then after I was in a state of shock, and what to do? I have to go up with this. But doctor did not told me to reduce your carb. He told me that you continue as you are taking food, don't take sweets, don't take rice. That's all. So, and he prescribed medicines, first the metformin as usual. After 6-7 years, I went to a endocrinologist. He prescribed glimepiride. That was the biggest mistake I have done to take glimepiride. Now I am realizing all this. Why I am telling that those people who are taking these medications should take note of it. But glimepiride actually killed by most of the beta cells. And I took glimepiride, say almost about 8 years. Then in 2008, the endocrinologist has added one more, that is pioglitazone, for reducing the insulin resistance. Then again, after some time, when I reached to doctor, say 2 years after that, my sugar was not under control. Fasting always goes above 120, 130 like this, and PP somewhere 170, 180, and 200. So I told doctor, sir, it is this, what to do. And one thing I would have to tell you, just which I forget to tell you, that when I have been diagnosed with diabetes, the diagnosis of diabetes is just based on the blood sugar, and that too, no HbA1c was available at that time.
So it was in, I think, 1993?
Yeah, 93, almost 93, 94. HbA1c comes later on. Even I remember one of my friend, a college friend who was in my cricket club, he was type 1 diabetic. And at that time, he has to check his blood sugar with the urine stick. And they put the urine on the stick and then put in the bendic solution and color the solution, tell that what is your diabetic. But now we have advanced so much.
Yeah.
So I don't know what was my HbA1c at the time of the diagnosis. When in 2008, I went again doctor that saying that sir, these medicines are okay, but it is not working on me. What to do? He told me, Arun, you have to take insulin now. I get scared of that. I told doctor, insulin is, I don't think it is good for me. I heard lot of things about the insulin. So if you can add something. Then he told me, now, okay, you continue your diet and continue this medication for more some time, 1 year or 2 years. Then you come back to me. I will see whether you need insulin or not. This was the scenario. On that day, actually, I told, I wanted to tell that I don't have any trust on this endocrinologist. Say, at that time, he should tell me that you have to reduce your carbohydrate. He tell me that, okay, sometimes even if you take sweets, no, there is no problem. It's
Okay.
no problem in that. And just to reduce rice and reduce roti also. That two roti 2 or 3 times a day. That's all. Fruits, he did not tell anything that you have to reduce fruit or not. Then I was thinking to do something alternative to this, that I know that medication and these things will take me to sometime in the dialysis unit, or I will lose my eyesight or something like this, or amputation of leg or something like this. So I get scared of all this, searching on net, because at that time net has come to India and I was using the net. I come to a platform known as the Health Unlocked.
This
And
was
they,
in 2014.
it was not prior to that. It was somewhere in the 2011 or something.
Okay.
Health Unlock was I think other
Yeah.
members are also at that time the member of
Yeah, they
Health
were
Unlock.
aware of this.
So there is also a lot of confusing, I mean, guidelines or suggestions were there. Then I found Anup Singh there in Health Unlock. He has been actually terminated from the Health Unlock, you can say, and me also later on. So somebody told me that you go to D-Life and change this. So I joined D-Life, and in D-Life the things were totally different to what I was doing or what I was practicing. Being a guy from pharmaceutical industry, I have till that time I have a lot of faith on the medications. Simply, so then leaving the medication and adapting a new way of life, new way of eating is somehow I have a lot of suspicion in that whether low carb will do harm or whether low carb will give me some benefit or not. Because taking a fat or high fat diet or taking high protein diet, I have fear that it will increase my cholesterol, it will increase risk of the heart attack, heart disease, or the protein will certainly
Protein
ruin
can
my
fight the
kidney.
kidneys.
This was the common. I think this was the common belief in the society or belief in even the medical community. So when I adopted this, then I went to my family physician who first diagnosed and treated me. So I told him, doctor, I wanted to change to this. This is the diet pattern. I have to take somewhere about above the 100 gram of the fat at least every day. Then the protein somewhere 50, 60 gram or 70 gram. At that time, I was knowing that only. So he told me, Arun, look, you can take fat, no problem, but it will increase your risk of a heart disease. It will increase the risk of your high cholesterol. And if you take that much of protein, your kidney will be ruined, kidney will be damaged. Then what to do? Ultimately, I thought कि ऐसे भी तो अपने को डायलिसिस यूनिट में जाना है, तो why not I should try alternative? इसमें बुरा क्या? ठीक है, अच्छा कुछ नहीं होगा तो बुरा कुछ नहीं होगा तो अच्छा भी कुछ नहीं होगा तो चलो ठीक है, लेकिन हम जिस पोजीशन में उससे कुछ चेंज तो होगा. तो I changed my food habits to the LCHF. At that time, Anup was and one member also HST. Now he is not no more active, that much active in the day life. So these two guys told me how to increase fat. First thing, increasing fat and reducing carbohydrate was a big jump in my food habit because at my family level, घर में लोग बोलते थे कि अगर रोटी नहीं खाएगा, if you don't take roti and rice, then what you will eat? This was the common question. Then I also started searching what to eat, and some of the guys in the D life also guided me what to eat. So I shifted to hung curd, shifted to paneer, shifted to chena, and shifted to cheese. These all I have started shifting. And it took me about 2 months to 3 months to converting, reducing the carb and increasing the fat. And along with the fat, I have also increased the protein. Then at that time, I decided that I should be grain free, no grains at all. Even the vegetables which I will take, I will first see the what is the carb content of the vegetable, and it is less, then I will do. At that time, my carb limit was somewhere about 50 to 60 gram. My blood sugar has changed drastically. My fasting somewhere around 90, 100 or 85 or 80, something like this. And one more thing I would like to mention, the moment I have shifted to ketogenic diet or LCHF diet, I have started reducing my medicines also. Since I was from the pharmaceutical background, so I know how to taper down the medicine. So gradually I started tapering down the medicine. And within 3 months, I get rid of the pioglitazone first, then slowly glimepiride, and then only metformin was continued to be that I thought the metformin is a harmless drug, it's a good drug. So metformin continued, but other two drugs I have stopped. When I stop, there is a slightly change in the blood sugars towards the higher side, but gradually it has also come down. Later on, as I learned from the people, I mean, this other people of the D Life and other members of the D Life, as well as from the NAT and other community, that protein is also important. So you have to keep eye on the protein. So I started increasing my protein and all, and this is almost 7 years on the keto diet or LCHF diet, with the high intake of the fat and protein and very low intake of carbohydrate. Nothing happened even after 7 years. That's all. Yes, Jasmine.
Okay, thank you so much, Arun Kumar. So, viewers, Arun Kumar, he has a history of 20 plus years of diabetes, and he was first diagnosed in 1993, and he tried many things. First of all, medications, of course, and he, as he said, he has a lot of trust on the medications because he himself belonged to the pharmaceuticals. So he tried all the different kind of medicines, starting from metformin, glimepiride, and then pioglitazone. And as he mentioned, the glimepiride medications, it's like, they like gradually kills the beta cells of the pancreas. So due to which Arun Kumar's, I think he started LCHF low carbohydrate lifestyle in 2015. And until I think at present also he's following not LCHF but the keto version of the LCHF. So when you have to go to keto, you have to reduce the carbohydrates drastically. Like he has to get into the range of 40 to 50 gram of, or maybe even below 40 grams of carbohydrates per day. But it's not the same for everybody. Like we have another senior members from D Life. Actually, it depends upon the diabetic history, as well as there are other factors also, which we can discuss later on. So as he took glimepiride, that glimepiride might have killed some of the beta cells of his pancreas, due to which his carb tolerance gradually reduces. We have other members like Anup Singh, who is the founder of D Live. He is more flexible with his carbohydrates intake, and as he can go up to, I think, 100 or even 120 gram of carbohydrates per day, and still he is well managing his diabetes. And I think he is in the non-diabetic range around 5.4 or 5.5 of HbA1c. So it depends on a person to person on the carb tolerance, how much do you have, and your diabetic history. So great, Arun Kumar. I think the one more, you have already answered the queries that most of the people have, because whenever anybody start LCHF, so at the time they start, they are very much curious to lower their blood sugar, because they come to us only when the blood sugar is skyrocketed, you know that. So at that time, their only motive is to lower the blood sugar. And from the first day itself, they start to see that their blood sugar numbers gradually start to decrease, and even their medications, they start to eliminate their medications. But what happens is after a few months, or even after 3 months, when they see that their HbA1c is getting normal, you know, and they start to see that their weight is getting reduced, particularly the abdominal fat. The first question the people that arises is how long they have to follow LCHF. So because they think that it is a cure, it is not a cure, because you have to manage your diabetes following the LCHF through your lifetime. So from your experience, could you please tell how we should convince the people that LCHF is the only right way of eating as per our today's lifestyle? It is not only just to manage the diabetes, but for their overall health. So
Yeah, Jasmeet, actually, first thing I would like to mention here that LCHF, or you can say the low carb, high fat or high protein diet, is the natural way of eating. It's not a new thing. If you go dig in the history, people are eating a lot of the protein and fat and very low carbohydrate. Our grain has been come to us 10,000 years ago. So after that, the people are depending on grains, and when they started depending on the grains, the carbohydrate intake has go high. So carbohydrate, high carbohydrate diet is not the natural eating, which I'm realizing that this is the not natural eating. What is the natural eating? Low carb. If you don't take grains, if you don't take pulses, if you don't take legumes, then your naturally carbohydrate intake will be reduced. And these all are coming to us, in our food plate, just 200, 300 back, legumes, or you can say the dal and all pulses are very new. Grains, of course, old. But more thing that the grains which our ancestors have taken were not the high carb grains. They are the low carb grains. If you can go see, many of those varieties are still available somewhere in the remote area. The rice and then the wheat. Those are the low carb rice and wheat which were cultivated by our ancestors. But now the modification of the genes, because I have read that our wheat has been changed 3 times. The number of chromosomes in the wheat, which was earlier 14, now comes to 42. So why they have changed? Because they wanted to increase the cultivation rate, or increase the crop. So that was the region, and in the process, the grains were the very high cap. So first thing that they should keep in the mind that this is the not natural to take grains and high carb diet. This is I'm not talking about the fast food, or not talking about this pizza, burger, and other things. That is the of course very latest. But these are the certainly bad for us. But even the grains are not good for us.
so the normal roti chawal that we people eat regularly is also not good.
Not good. These are the not natural. What we are now LCHF, what we are doing is the natural. So you have to tell the people that this is not the natural which you are eating. Of course, you may be eating, your father, your grandfather, your ancestors have taken this, but this is not natural. What is natural is the low carb diet. First thing. Second thing, low carb diet will keep you metabolically healthy.
Yeah.
The moment you start doing low carb diet, your metabolism will be healthy. If you have blood pressure, that will resolve. If you have blood sugar, that will resolve. If you have obesity, that will be resolved. So this indicates that you are metabolically going to be healthy if you are going to take low carb diet. So low carb diet is for lifelong, not for that I have, okay, mera to blood sugar niche aa gaya, now I can shift to old diet. No, this is not the right way. It is for the lifelong, you have to do this. And actually some of the clients has asked me the same question कि सर ये 3 महीने के बाद मैं क्या रोटी चावल खा सकता हूँ? उनके ठीक है, आप खा सकते हो, आप अपना मीटर देख लो, ब्लड शुगर का चेक कर लो, अगर इफ इट इज अलाउड यू, इफ इट अलाउज यू, देन इट्स ऑल राइट, अदरवाइज तो ये नहीं। दिस इज द नॉट नेचुरल. Stick to the diet which I have suggested to you. It will keep you metabolically healthy. And if you are metabolically healthy, then this diet is correct for you. Then one thing is that you take, if a person is obese, I ask them to take your weight. If you want to shift to your old diet, roti chawal or this all, then you after 1 month again check your weight. आप देखोगे आपका weight बढ़ गया, तो बढ़ गया क्यों बढ़ गया? Why? Because you have shifted to the old diet. So this is the one way to convince, or blood sugar monitoring is the another way. Blood glucose meter will tell you that whether your diet is correct or not. So by this you can convince your patient or clients that no, this is not the natural. Natural is what you are eating right now.
Yeah, you're right, Arun Kumar, because people should not just only focus on their blood sugar, but they should see their overall health, their energy
Overall,
level, how
yeah.
their energy level improves on LCHF. Actually,
Mm.
one thing I would like to tell people, why we eat. Actually, we eat to provide all the essential vitamins, minerals, essential amino acids, essential fatty acids to the
Mm.
cells of our body to
Mm.
remain energetic. And when we talk about LCHF, we focus on all these parts. We ask patients, we ask clients to first prioritize the protein and put the adequate amount of protein in your plate, and then add some essential fatty acids from some good fats, and then add some fibers and some vegetables to get the adequate amount of vitamins and minerals. So I think when they put all these, the mixture of all these food items in their plate, I think there is no space left for that extra carbs.
Correct.
So I think nutrient density is important.
Very important.
So the LCHF way of eating, it is a nutrient dense food, and with the little amount of food they feel full. Why? Because they get the adequate amount of vitamins, minerals, amino acid and fatty acids by this LCHF way of eating. So following this, I would like to ask, like, most of the clients, what they ask is, so after they have started the LCHF way of eating, their appetite reduce. They don't like to eat much. They don't even think of food. Like the people I have seen who are on high carbohydrate diet, they even count the hours and minutes. So when they were going to eat their next meal. And when they shift to LCHF, what happens is they even forget to have their breakfast. They even don't even think of having their lunch. So, sometimes what the society or the people around them start to influence them. They say that you are getting unhealthy because, the mentality of people is like, eating much or thinking more about food or having hunger pangs all the time. It is a sign that you are in good health, but this is not true. So what would you like to say about this?
No, first of all, that we have been seen, and we have been, people are teaching us or taught us that breakfast is very important meal of the day. And I say breakfast is not at all required for a human body. We don't need any breakfast. So when you switch to LCHF, low carb and high fat and high protein diet, you don't have hunger. See, if you don't have hunger, why you will go for it? It's not a time taken. I have seen many of the persons, अच्छा अच्छा 2 घंटा हो गया मेरे को तो diabetes, I have to take something. So I asked why you want to take some? No, doctor told me that you are diabetic, so every 2 hours you have to take something. Not even if you are not taking food, then at least take some 2 or 3 these biscuits, and that too recommend some branded biscuits. I don't want to take name of this, but then this is the way they have been taught that breakfast is must. You have to take breakfast. But I want to tell my experience since last 6 years. I did not have breakfast. Or even earlier to shift into LCHF, our job profile was such we don't have time to take breakfast. We are simply having brunch. I mean, at the 9:30 or 10 o'clock, and then in the evening only. Snacking, I don't like early also. Now also snacking, I don't like. Because when you go outside, तो snacking में क्या मिलना? वो market का roadside जो eatery है, you will get something. This I hate those. So first of thing, I would have to tell you that when you are shifting to LCHF, you will focusing on the taking protein and taking fat. So in the if you're taking sufficient amount of the fat, if you're taking sufficient amount of the protein, you will not feel hungry at all. If you don't feel hungry, why you will go for the another snacks or another meal of the day? So that's why I was asking that it is not at all required. Second thing, you have to take care of your micronutrients and macronutrients. Protein and fat is your macronutrients, and you have to also see the food you are taking, whether they are giving you adequate quantity of vitamins and minerals, essential vitamins and minerals or not. You have to focusing the food for that. Whether you are taking this, suppose you are taking egg. So egg have the different types of the minerals and vitamins.
It's like a multivitamin.
Multivitamin. So you have to take that, how much you have to take egg so that you can get this. In addition to protein, what other things you are getting, that you have to count. Suppose you are taking then vegetables, then you have to go through the nutrition chart and what are the minerals and vitamins are there and accordingly find. Even if you, I suggest right now here that even if you feel that or your lab test told me that you have a vitamin deficiency, then go for the, at the last stage, you go for the supplements. Otherwise, you take care of your vitamins, mineral intake, and macronutrients, that is protein and fat. And here, which is very common now, we are saying in our forum or even other social media also, that what is the requirement of carbohydrate to our body is zero. Even you don't have single gram carbohydrate in a day, everything will go very good, rather they will go better than your body normal metabolism. So you don't need carbohydrate, but there are certain things you cannot avoid. Suppose you are taking vegetables, so little quantity, 1 gram or 2 gram or 3 gram carbohydrate will be there per 100 gram. Or likewise, if you are taking cheese or taking this paneer and all, some carbohydrate are there, but you restrict your carbohydrate intake to only that. And now I am on the 20 gram or 22 gram of the carbohydrate per day, and that only comes from the vegetables and paneer and other something food which is essential like chena and all. Chena, I'm just telling to other people who don't know. Chena, we are telling the fresh paneer. Suppose you just fresh paneer, we call chena, and this you can take raw also without adding anything, putting some sweetener or putting some salt, and you can take like this. So that is the way. So your carbohydrate should be only intake should be only restricted to only these items. Fruits I don't take, another I never recommend to take fruits. That is altogether a different subject, but fruits also avoid completely, except your avocado if it is available to your place, and then some berries, blueberries or blackberries
And
you
it's
can take.
always, good to combine the fruit like berries or avocado with some fat to
From
slow
fat.
down the digestion so that, it doesn't spike our blood sugar.
It will also keep you full. Avocado is such a fruit that it will keep you full because. But remember, those who are having the high potassium serum level should avoid taking the avocado. Avocado is high potassium, so you should avoid those. Otherwise, rest fruit, say goodbye to all fruits. That's why. Yes, suggestion.
Thank you, Arun Kumar. So you are right, Arun. So following the LCHF, gradually what happens is we don't even think of having a snacks, or we even forget to have our breakfast. And you are right that breakfast is not at all important. And I tell my clients that breakfast is important in the sense that it is the first meal of our day. So it's not about the time; it's about what you are taking during the first meal. So that is important. It's because people just think that it's the morning we have to have our breakfast. Is not the in the morning, it's when you are breaking your fast. It can even in the noon, even
Yeah,
in the
correct.
noon you can have your breakfast. So it's not about the timing, it's about the it should be high protein intake. That's what we recommend. Even Arun Kumar, I have seen that there is one research that has shown that people who prioritize the protein in the first meal, their
Mhm.
inflammation level reduces drastically.
Very
And
good.
even the people who, no doubt, they are following the LCHF way of eating, but if they don't prioritize protein in the first meal and they take some high carbohydrates during the first meal of the day, their inflammation level increases.
Correct.
So inflammation is really important factor when it comes to any health disorder, any metabolic disorder. So my next question is, You have already answered it, but I would like you to, again tell people about this. Like, when you started the LCHF way of eating, there are many questions that come to your mind, like, because we here prioritize protein, we also increase the fat as compared to our normal high carbohydrate diet, where we people generally, recommend don't take fat, but we only recommend people to have the healthy fat, not the normal fat like from the seed oils and all. We completely stop all this in this LCHF way of eating. But like the medical professionals, like you mentioned that your doctor also told you that you should not eat a high protein diet, it may affect your kidneys.
Correct.
Like this influence, the people start to influence when we start to, during the transition and even after following the LCHF, even when they see the good results, the people around them start to influence them, like it can reduce, it can damage your kidney in the longer term. But I think, Arun Kumar, you are a live example in front of everybody, because you are following LCHF, you are prioritizing protein since last 7 years. Even other members like Shashikant Younger, he's, I think, having around 100 gram of, more than 100 gram of protein per day. Even Anup Singh, he's taking adequate amount of protein. You all are the live example in front of our viewers and other people. So could you please tell our viewers that taking adequate amount of protein in the last years, how does it impacted your other blood work, like your kidney and other overall health?
Actually, I would like to tell you that when I started LCHF or keto diet in 2015, so first blood work I have done after 3 months. So after 3 months, there was not much change in the HbA1c, but I have seen some changes in the LDL. So I went to doctor because LDL was another problem that created by the mainstream doctors. So तुम्हारा तो LDL बढ़ गया भाई. So what to do? You are having a risk of the heart disease. So anyway, so LDL was increased. Triglyceride, of course, it was earlier also high. Somewhere I remember triglyceride was somewhere above 160 or 165 something. I exactly number don't remember, but LDL was somewhere around 200.
But at present, your triglyceride, I think, is below 100, na?
It is 95. It is continuing for last 1 year. Last 1 year or so, or more than that, triglyceride is 95, sometimes 94, and right now my HDL, high
Your
density.
HDL is quite good.
So that is 94 and 95. Triglyceride and HDL going hand to hand. I mean, both are going same way. So that is the, and second thing I found that cholesterol level, my cholesterol level has increased. So I was, at that time, I was having some fear about the cholesterol. Now, after reading all these and seeing many of the other cases, my cholesterol level right now is 300, say 21. My cholesterol level is 321. So, excuse me, my cholesterol level is 321. Doctors are saying it's a bad. What I am saying, it's a very good, because I know that cholesterol is also working as an antioxidant. It is very good for our body. It will take care of our body with different metabolism. Apart from the other function, I read recently that it is a very good antioxidant also. It will keep your metabolism is healthy. It will keep your metabolism healthy, particularly when you are aging. So more you passing some years, you need to have higher cholesterol. So above 60, if your cholesterol is 300 or more than 300, don't worry for that. Even for below 60, you don't worry for that. So, but at that time, when doctor told me that you are at a risk of that, but I continue to my fat intake about 130 gram, 140 gram, sometimes 150 gram. This comes from the virgin coconut oil, then butter and ghee. These three things were the main source of our fat. Egg I have introduced later on in my LCF journey, that is in 2017. 2017 last, when I have seen my very close friend that is on D Life is Sasi, he started taking egg. तो हमने कहा वो जब खा सकता तो मैं क्यों नहीं खा सकता. तो I started taking egg. Now I am on the four eggs, 5 eggs, sometimes even 6 eggs. That so nowadays my protein, fat are coming from this cheese, paneer, then your egg, and fats mainly coming from the PCO, butter, and ghee. So this is my all about this. My carbohydrate intake is only limited to paneer and some vegetables. Vegetables I have also now reduced. So only for intake of the fibers, I am taking some vegetables, otherwise no. So in my opinion, don't scared of your cholesterol level, don't scared of your LDL level. These are all good for you. Simple thing.
And what about
Yeah.
your kidney function test? Because you are taking
That's
enough of protein.
yeah, I forget to tell you. My kidney function is very, very good. No problem at all. No problem at all. My kidney is in a very good shape. It is nothing wrong in this. My every parameter is okay. I have 6 months back, about probably in the month of August or September, I done my kidney function test. It was all good. Excuse me. So my kidney is all very good, no problem. So kidney function is every aspect of kidney is good, not nothing, no variations from now, or even though I'm on a high protein diet. Okay. And a blood test, I told you, kidney function is okay. And most important is my liver function test is absolutely fine. No deviation. All, I mean, liver enzymes or transminase are okay. My other bilirubin, other things are okay. So I don't find even after 7 years of the keto diet, any changes in my, I mean, any negative changes in my blood test or negative changes in my kidney function. These are all about this.
So, okay, so thank you, Arun Kumar. So, viewers, I hope that you got it. That LCHF doesn't affect your kidney. Does can even if you are prioritizing protein, even if you are taking 100 grams of protein per day, it is not going to damage your kidneys. But the one thing is, like, you have to restrict the carbohydrates. So the carbohydrates, they are the culprit. Good fat and protein is really essential and it is required by your body, so don't get scared from it. So the next thing that I would like to ask Arun Kumar is, like, one thing that I have seen in people, when they start to follow LCHF, no doubt they start to lose weight, from not only from the belly, which is the one of the dangerous fat that people have, but they lose weight from all over the body, like from their face, from their arms, from their legs. And gradually they start to look weaker, because we have a habit of seeing those people like bod golu molu healthy type. And
Correct.
what happens in when drastically there's, because LCHF you lose the weight drastically. So no doubt it's a gradual weight loss, but when you look weaker, the people start to say like you look weaker because आपने रोटी दाल चावल छोड़ दिया है इसीलिए. So
Correct.
how was your experience when you made a transition to the LCHF? So did you also face the same
Yeah.
difficulties?
एक्चुअली जसमीत मैं कभी मोटा भी नहीं था. तो एक्चुअली आई वाज नॉर्मल साइज पर्सन. बट व्हेन आई हैव स्टार्टेड LCHF, so my weight further reduced. Actually, before LCHF, I remember I was nearly about 68, 69 kg, having the height of 5 feet 9 inches. So it was looking normal. But after starting LCHF, within 6 months, 6 months time, sorry, my weight has reduced to 62 kg, and I was very lean and thin. And everybody in my family and relatives and friends, क्या खाना वाना नहीं मिलता है, क्या गाल पिचक गया है, ये हो गया, दुबले हो गए. So I told him that right now I am in a correct weight. I am in a correct weight. I am having full of energy. I am still going for the 6 kilometer, 8 kilometer walk every morning. Then doing all the chorus of the day of the household and outside also. So I am not feeling any low in energy. Neither I am feeling any weakness. So it's all this appearance which the excess fat of my body has gone away. That's what my reply was. Slowly, they convinced, and most of the time, my family members and some of the close relatives, they are telling, "Yeah, why not you are eating some rice and roti?" That was their feeling. But we have to very adamant on that. No, I will not take.
So you
But
mean that
yeah, I am full of energy, but I lost some of the excess fat from the abdomen, wherever the excess fat of abdomen, some excess fat on the back of my wrist, then some leg. This excess fat has gone away. Now I am currently weighing about 63 kg, and height is just 5 feet 9 inches. So there is no change in that unless until just some of your well-wishers will tell you that you are looking healthy and fit. That's all.
I tell you about one of my patient. He came to me just for his acid reflux issue.
Acha.
No diet, no. I think that no doubt that he must be having some metabolic health disorder as well. But it was not because he was very young, like around 35, 36. And what happens is he was already underweight. His weight was around 60 kilogram. And but following LCHF, what happens is he lost around 5 kgs, and his acid reflux problem it's obviously is completely sorted out. But what happens is after 3 months he's told me that he never wanted to lose his weight.
Hmm.
So he told me, I never asked you that I want to lose weight. I just wanted to get rid of this my acid reflux problem. So you what you did that I lost 5 kg, I never wanted to. Now I want to gain weight. So he actually, people don't understand, it's not about the gain of weight. They should focus on like the muscle mass.
Yeah, correct.
One should increase their muscle mass, because he lost all his weight from his belly around abdominal fat.
Abdominal
Though,
fat.
because we have seen in India, the people, they have abdominal obesity, they are like toffee, they are thin outside and they are fat inside. So
Fat
he
inside.
also came in this category. But LCHF is the only way by which we can get rid of this visceral fat. But it's really difficult to make people understand about this. They just look from outside, how they look from the outside.
Actually, this is the social stigma that if you have a fat, if you have a visceral fat, you are a good and healthy person. This is a stigma in the society. But this is not correct. This is absolutely wrong. You have to lose all this faltu fat, which is not required to us. And then your body will be really what it should be. And as you quoted the case of this acid reflux. So uh, that was the problem when she shifted to on the LCHF 5 kg weight loss. 5 kg weight loss. Why she is anxious about that? Because cosmetically she is not looking good. That's
Yeah.
what. Otherwise, nothing is bad in this. But gradually, if she will increase the protein, then again she will gain some weight. That is muscle mass,
Muscle mass.
some muscle mass. I have also, when I have increased my protein intake, then I 2 to 3 kg I gained again. So, but that is the muscle mass, not looking anywhere in the belly or visceral, nothing like that.
So
Okay,
that
that's
is the point. Okay.
that's
Thank you, Arun Kumar. So I think anything else would you like to cover, Arun Kumar? Or
one thing I like to tell also apart from all these, that fasting. I was doing fasting when I shifted to LCHF. I started intermittent fasting. After researching and all on the net, I found that 16 is to 8 intermittent fasting is very good and very suitable for me. So that's why early morning breakfast is not needed. Last night dinner and then directly to the whatever the lunch, that is 12 noon. So intermittent fasting also done very good to me, and I'm still continuing that intermittent fasting. And apart from that, I'm also doing fastings about once in a fortnight. That is almost about 36 to 40 hours fast. That is our ritual is Ekadasi fast. So that is also without taking anything. So fasting also important when you are shifting to LCH, unless until you are weak, underweight, or you are pregnant. Otherwise, you can
yeah.
do fasting. Intermittent fasting तो करना ही चाहिए. Everybody should.
Actually, I also recommend to almost all my clients, but first thing I do is like after they completely get transition into the LCHF, then intermittent fasting really becomes easier.
Easier,
Because
yeah.
if a person is on high carb diet, we can't directly ask them to, just skip your breakfast because
Mm,
their hormones are just completely out of balance. They have high insulin levels. So
mm,
until their insulin levels get back to the normal, it's really difficult for them to incorporate the fasting into their regimen.
correct.
So I think you're right. Intermittent fasting do help, but first gradually make a transition to the LCHF way of eating and normalize your insulin levels, and then gradually start to increase the gap between your dinner and your breakfast, and make your breakfast in the noon, like take it together
Correct.
with your lunch, make your lunch as your breakfast.
Now, best thing that you can take your first meal of the day as uh, you can make it delay as delay it is possible, but not before 12 o'clock.
Yeah.
Take 1 o'clock, 12 o'clock, 1:30, 2 o'clock, like this, and try to increase this period more. So right now I'm about 17 plus 7 hours intermittent fasting. I've shifted gradually from 1 hour, from 12 o'clock to 1 o'clock. This is very good for that. When you are rightly mentioned here that what is happening in the morning, with normal person, insulin increase, that is due to the insulin increase, and this insulin increase will also increase the other hormone levels like ghrelin and all, and it will start hunger pang, you feel hunger pang. So if you are shifted to LCHF, insulin will not come, so that your ghrelin level will be also controlled, and your leptin level will increase,
Yeah.
so you will not feel hungry in the morning, even in the noon. So, and most of last of it, that take the meal only when you are hungry, not with the clock. कि चलो 2 बज गया तो खाना है, 8 बज गया तो खाना नहीं. Take the meal well only when you are hungry. These are the two, 3 points regarding the fasting is very important.
Yeah, this is
Yes.
important. The intuitive eating is important because
Uh,
teach all my clients that eat only when they're hungry. Don't
mm,
just go by the clock, like the 2 hours, 3 hours have passed. Now they have to go for some snacking and all. So I
mm.
think Arun Kumar, this is the difference between a dietitian and us. We are not dietitians. We
Yeah,
don't
yeah,
just give a charts like eat this at this time, eat this
yeah,
at this time.
yeah, yeah.
We just educate the people about the food, what are the right food for them, what are the right food for their body,
Mm.
because every individual is different. Like you,
Yeah, correct.
Shashi, and Anup Singh, all of you are following LCHF, but if we compare, all of you are taking the different amount of carbohydrates, different amount of fat, and different amount of protein.
Protein,
So
correct.
we all are different. So
Mm,
it's important, like don't go by clock, eat only when you're hungry. When you start listen to your body, like you
mm.
will automatically get healthy.
Yeah.
So thank you, Arun Kumar. I think one more thing that we should mention at the last, like you have already mentioned about the blood parameters like triglycerides,
Mhm.
HDL level, LDL level, and I think that whenever a new person come to us, there are few blood work that we ask them to do.
Mhm.
So which actually can tell us about their present metabolic health, like the triglyceride. We normally take the triglyceride to HDL ratio to see how metabolically ill they are. Like in your case,
Mhm.
your triglyceride is around 94 and your HDL is also very high, above 90, and it's around 1.
Is to one is to one ratio. 1:1 ratio. Actually, when you first shift to LCHF, this is recorded, and many of the study have found that your LDL will bound to go up, and your triglyceride will come down.
Yeah.
And if you are taking healthy fat means ghee, butter, coconut oil, or healthy fat, whatever it is coming from the animal source, your HDL level will bound to go high. So your FGL level will go high, your triglyceride level will reduce. So that the ideal situation is 1:1 SGL and triglyceride level.
Yeah.
Okay. And even in that case, if your triglyceride is lower and SGL is higher, that is the very, very ideal way, ideal situation. Yeah.
Yeah.
So try to make your HDL and triglyceride both equal. I mean, ratio should be 1:1. That indicates first thing that you don't have any insulin resistance. That is the very important thing. Second thing, if you don't have insulin resistance, so you don't have hyperinsulinemia. Okay, excuse me. Yeah, some blinking was there. So when your triglyceride and HDL is one, ratio is one, you don't have any insulin resistance. If you don't have any insulin resistance, there is no chance of getting you hyperinsulinemia. So your serum insulin level will be normal. And if serum insulin level will be normal, you are metabolically, don't have any risk of the heart disease, hypertension, diabetes, or say any other issue, even the kidney issue. It has been seen that high insulin level is impact your kidney function. So all these liver
And
function, kidney
even
function,
PCOS.
even PCOS are very correct. If the PCOS, what we see that estrogen level go high in PCOS cases. How it goes high? Because this high insulin level will, I mean, increase the conversion of testosterone to estrogen. And if estrogen will go high, then cyst will form and you have a PCOS. So all these parameters will be normal if you eat LCHF. Correct.
So,
If you
yeah.
blood marker is insulin, I mean HDL and triglyceride is 1:1, it's very good. Other also, you will have a other function that your I mean minerals you have to see that what minerals are levels are there. If your sodium level is low or
Yeah.
potassium level,
Potassium.
you have to take that and maintain that. These all things is essential for this.
So
Yes, yes.
thank you, Arun Kumar. So viewers, it's good that even so what you wanted to say, like even if you have a normal blood sugar numbers, so you see your triglyceride to HDL ratio. If it is less than one, it means you are healthy. Your risk of getting diabetes or risk of getting any metabolic disorder in the future is negligible. And when your triglyceride to HDL levels start to get above one or above two, it's alarming for you. So you have to change your lifestyle so that you can get rid of any other metabolic disorder in your future. So thank you so much, Arun Kumar. So I think now we can open the session for the viewers. If something is left during the discussion and you have any query, you can ask.
Unmute, Sasi, can you
Shashi?
unmute all this?
Yeah, all are unmuted.
Okay, okay, okay.
Viewers, if you have any question, you can ask us, or if you want, you can also type in the chat box. So we have all the experts from D-Life with us. So you can ask any question, whatever you have in your mind about LCHF way of eating, you can ask.
There is a very good success story by Mr. Bhishma, which is in the chat box. Just within 8 days of LCHF, fasting blood sugar has come down from 140 to 105, postprandial around 200 to 140, and HbA1c was 10.5 10 days back, and that will be measured again. And even in these few days, the weight has come down by around 2.5 kg. So I think
Very good.
this is a case where they can see success right from the first meal itself.
It happens in most of the cases. Some bodies, they immediately start to show the results.
Actually, all depends that when you are coming for the LCHF. And second thing is your age. If you are younger, then metabolic response will be very fast and rapid. So you will get rid of all this.
Yeah, it depends on the diabetic history, and I think the sooner the people react, and
So I hope there is no question.
I think, yeah.
Chat box, check your chat box if you have a question.
I think there are no more questions. I think you can, wind up.
Wind up the session now.
Yeah.
So, okay, thank you so much, viewers, for your time. And at the end, I would like to tell the people, like, if you want to know more about Arun Kumar, we will put the link when we upload the video on the YouTube. In the description box, we will put the link of his success story that he has reported last year, and also the success story of other senior members, Anup Singh and Shashikant Iyengar, will be there in the description box. So thank you so much. You can also visit our website www.dlife.in for all the information about LCHF. So, and you can also see the success stories that I told you that we have already reported more than 250 success stories that is available there. You can go through all of them. So thank you so much. Thank you, Shashi. Thank you, Arun Kumar. Thank you, viewers.
Thank you.